Welcome to Icon EMR. We're super excited to have the opportunity to give you a short demo of what our software does. Our website is icon.health or iconehr.com with a K. Here you can scroll down and you will see a lot of different features that we have. However, you will not see the more proprietary features that we have because we want to keep that a little bit more private. The software is 100% cloud-based, so meaning that you can log in 24 hours a day from any part of the world. You can also have multiple locations for no extra cost. So in this particular case, you go to locations. In this center, we have 4 locations. And each location can be individually run with a different tax ID number, or they can all be under the same tax ID number. The system is built into different pillars. The first pillar is the patient demographics, which you will see in just a few minutes. The second pillar is the patient documentation. How does the doctor or professional technician do the documentation? SOAP notes, evaluations, examinations, and SOAP notes. Scheduling. The scheduling is completely customizable, and you can have multiple providers on the same screen, and you can customize your schedule. You can customize your time. You can customize how many patients you see per hour. It's fully customizable on almost everything that you can think of. It also has text messages, reminders, and you can text message patients at any time. The software also has billing internally, meaning that you can send bills electronic or by paper. We're going to dive into a few of these in just a moment. In this section, you'll see the dashboard. The dashboard will always have your company logo at the top. And you can also choose to see all location information or just one location information, whatever you prefer. You can also customize your dashboard and only allow the things that you want to see on your dashboard. So for example, if you don't want to see your patient satisfaction or payments or census, you can control that. You also have access to create roles. So if you want a role for the front desk versus the billers versus the therapists versus the managers, then you can customize roles and create your own roles. So in the dashboard, you can turn on and turn off features. You can also rearrange the orders of what you see down here. So the top section represents the bottom section. So if you notice, my checked out patients are second. If I wanted this to be first, I would just move it to the right, and all of a sudden your checked out patients are here. You can also expand and change the view of any of these sections here. So you can expand and you can close again. So you can say, hey, I want to see all my new patients, all my checked in, all my incompletes. The software also knows, how many patients got checked in for the day or for the week or for the month. And you can pull those reports by simply clicking on the date frame, the filter, and filtering by date. You can click on here and this will expand. Again, you can change the view. So let's take a look at the patient demographics. You can create a new patient first. And when you create a new patient, we can collect any information that you want. You also have access to give the patient access to the portal. Or if you don't want the patients, or you want the patients to make their own appointments, you can also give them access to that, particular or in general. In the patient information section, you can collect as many information that you want. We have about 50 different questions that you can ask the patient, from gender identity to financial class and preferred language. And we can turn those features on with just a simple button over here under patient settings and practice preferences. So there you can add that. Once you create a patient, it'll take you to the patient demographics section. And in the patient demographics section, this is where you create a lot of different pieces of information, including these pop-ups that you just saw here, which we call patient notifications. So you can have alerts pop up at any part of the screen for any particular patient. In the patient demographic screen, this is probably the most cumbersome patient demographic screen in the system, because you can take a picture of the patient, you can text message the patient directly by clicking here, you can email the patient directly by clicking here, so you no longer need to use your own email, and we can attach this to your email. So if you're using GoDaddy or mail.com or one-on-one, like anything that you want, we can attach it to your email. In this section, you also see just some vitals: when the patient was last, when the next appointment is, when the date of accident was for the car accident clinics or the PIP clinics. And over here you have the patient information. The software is pretty cool because if you attach an attorney, the system will recognize that attorney, and the attorney can actually log in after you create a user, and they'll see only their information. You can also track the referral source, the case manager, the pharmacy for those physicians that like to send prescriptions by electronic. You also have the balance, whether it's the patient, the total account, or the insurance. You can separate it. And you can also collect credit cards, by clicking here. The credit cards we have to set up with a merchant that we have exclusively because we've had to hard code it. But you also have the next of kin in case you want a person to notify. And then you have your visit history over here. Your visit history you can expand by clicking here, and you'll see a little bit more data, whether they have co-payments due or or deductibles due, or if anything's been applied. You can also see it right here on this screen. You can also see all the visits that they canceled, that they checked out, that they arrived, or that are yet to arrive, meaning future appointments. So it's, you see all that here at the visit history. Now on the right hand side, you have a copy of their ID. You can scan a copy of the ID, and you can attach an insurance company. You can also attach a secondary, a tertiary, or a fourth insurance here. So once I add the second, the third one will appear. Once I add the third one, a fourth one will appear. These are your patient notifications where you get to set alerts, you get to set authorizations, other family information, customize anything in the custom fields. And then you have this notes section where you can create notes so that everybody in your company knows what's going on with that patient. So you have a little notes section. On the left hand side, you have more information like case information for that particular visit, or any other information here where it's this little arrow to the left hand side. You can see the patient information, more text. You also have this document section where you can store as much documents that you want for the patient. It doesn't cost you anything. So you want to store medical records from other doctors. Also, every time you create a SOAP note, the software saves it as a PDF. In this section, you can select the note, you can fax it directly from here, you can email it directly from here, or you can download them all at a snap by choosing this download button. You can also import files. If you want to import files from your hard drive, you can send by fax, you can send by email, or you can move them into different folders. Okay, and that's pretty much it. There's a lot more detail here that we can discuss, but this is a short demo. Your consents, you can send consents electronically or by text message. So if I click here, I can send this by text, so the patient, once they arrive, they no longer have to sign any forms. You can literally send them this before they arrive, and they can sign all their consents. Then you can see the consents here by selecting this print once they've signed. So if you notice that this patient has signed 2 consents, he's missing the notice of privacy, and I can tell because there's no print here. So I wanted to send that patient if I wanted to send that to the patient, I can just click send by text or send by email, and the patient can sign it directly on his email or on his text message. You can also see the charts, and you can create quick notes that are non-billable clinical notes. So for example, somebody calls to find out about their MRI. You're not really going to bill that review, but you can create here a note that says, hey, patient called, he wanted to know about his MRI. I discussed this with him to come in. So it's a note, but it's a non-billable clinical note. If you want to go to the patient chart, there's 2 ways. You can go through the patient demographics by clicking on this patient chart, or you can go to patient charts up here and search. Now there's this filter because you can search by provider, or you can search by clinic. In this case, we're in the Miami clinic and we're in the provider Andy Zapata. So here, I was just going to search for my last search, which is Anna. And on the left-hand side, you'll see a couple dates up here. And the red means that they're incomplete, and the green means that they're completed notes, meaning they have a signature, the doctor has signed off. Okay. You can also have co-signers sign off, so you can have 2 providers. And to enter a note, simply click on the incomplete note, and you can click on SOAP to go into this. But before this, I want to show you the appointment scheduler, meaning the schedule. When you get to the schedule, these columns are very customizable, and also you can pick whatever columns you want. We have a couple of probably like 50 or 60 columns that we've created for other providers. So here, once the patient is checked in, obviously you got to check the patient in first. This patient has already been checked out, so click on the name of the patient once it's been checked out, and here you can start the SOAP note. The most incredible thing about our software is the ways that we can do notes. The notes, we can dictate notes. The notes we can also, so you can dictate notes, you can free text. You can have checkboxes on your notes, just like this. So you can have checkboxes, and these checkboxes, you can create your own checkboxes that you want. Or you can create your own titles, and you can rearrange them however you want. You can also say, hey, I don't want more than 1 answer from here. And you can also create paragraphs. So you can create these sections over here that will create paragraphs however you want. And this is a demo, but they're very well organized in other accounts. So you can also have your treatment plan or whatever checkbox equal CPT codes, or you can come in, enter as many CPT codes or ICD-10 codes, diagnostic codes as you want on a fly. Okay. Once you're done, you sign out the note. It'll give you a preview. The doctor signs out, and he puts his password. That way it's password protected, and then that becomes a SOAP note, a signed out note. You can always come back and edit it if you're the doctor. Now on the billing side, you also have track on referrals. So if you made a few radiology orders like MRIs or X-ray orders, you can keep track on this log. You can also print it. And for the billing, on the billing side, you can keep track of all your billing. And here's your section on the left-hand side. And you can also filter by provider, by date. If you want to select all locations, just leave it blank. And if you want to go back a couple of days, just go back and you'll see all the data. All the data. You'll search. This will show you what's been billed, what's been waiting, what's been pending, what are your new charges in your center. And every time a doctor finishes the note, it jumps over here so that the billing team knows what's pending or what's new to bill. If you notice, this patient, Maria Gonzalez, is a test patient, but she has Geico and she's ready to bill because it's under the new section. In order to create a bill, it's very simple. Click on the patient name, and if it says pending, it's because the notes are still pending to be completed. Click on new case. You gotta add a diagnosis. Then you click on new case. What this does is gonna jump into the case. This is how the billers bill. This is the bill. Select the referring physician if it's important for you or in your practice. And here you can just sit. If you notice on the left hand side, it's gonna go from new over here to when I save it, assuming everything is perfect and I checked everything, it says ready to bill. When I hit submit to the insurance, that means it's going to change from ready to bill to submitted, and it's going to give me a copy of the HCFA form for me to produce and send to the insurance. It's really that easy. Now we also have the ability to send these files electronic to the insurance through a few different clearinghouses. So in this particular case, it's going to give me a view of a HCFA form. But this is if you bought the HCFA form. If you didn't buy and you want to use a template, literally go to paper claim, plain paper, and print. And this is going to print the HCFA form in the form of a pre-printed format. And that's it. That's the documentation, the billing, the schedule, and the patient demographics. Now, this is the patient portal. The patient has access to book their appointment if you want them. They can pay their dues if they have any co-payments or deductibles. They can also sign their consent forms right on the fly, and they can see all their balance. They also have a lot of features, so if you want to help give the patient some documentation, like exercises to do, you can send them documentation, home exercise programs, or any medication you want them to follow. The patient portal has many features, but that will be for the longer demonstration. The last pillar that the software has is this patient portal. So in the patient kiosk, this is your clinic kiosk. So when the patient comes in, they can check themselves in, and they can also have questions to answer. Those questions, you can import them into your documentation, or you can import them into the patient's notes section. So if the doctor wanted to see, hey, how is your pain level today? That can literally go into the SOAP note. Or if you have any other questions to answer, that can also literally go into the SOAP note. Now, I hope that you enjoyed this short demonstration of what the software does. I'd love to have the opportunity to show you more about what the software does, and have the opportunity to maybe show you a lot of the artificial intelligence features that we have into the software. I hope this helps, and I will talk to you soon.